And when I learned about him, guess what? What was parallel? The first person I talked about, they knew each other. They grew up right around the corner from each other. It's like somebody growing up in Southwest Detroit. They knew each other, family and everything. Another death row case. Another 28, 29 years old. And, you know, anytime you harm a law enforcement person, you in for some trouble. And I mean, they gave him the beatings. They tried to kill him, but the bullets didn't kill him. And he refused to cop. He wasn't cop. And so, but he was tired of being in that situation. But he wasn't ready to not live. He wasn't giving up on life. And so that was my job, was to help the team, again, persuade this judge on why we should give him life in prison versus taking his life. Same situation. A week later, attorneys called and they said, Andre, you must have did something. He took a plea and we sent him over to prison, and they're not going to take it. He's not going to have to die. At least like that. But again, these are horrifying cases. But the key is, again, the same thing. Mental illness, poverty, it all goes together. And people are just not getting better. And the more you grow up, the more you're in the thick of it, the more susceptible you're going to be to get caught up. So when we think about mental health illness, you know, we have something called evidence-based criteria, which is something that was developed. How many of y'all heard of the DSM-5 TR? Small handful of y'all. So if you really want to understand anything that involves mental health conditions, you want to use evidence-based criteria, and that's considered the Bible for psychiatrists, psychologists, social workers, and people who assess people for mental health illness. Because that provides all the information on how you provide the right diagnosis. We have a lot of problems in our community where people are overdiagnosed and underdiagnosed, and they diagnose them based on what somebody says or what they think. And that's not the proper way to diagnose people. Obviously, you know, there's a clinical assessment, you know, that has to be done, and typically the clinical assessment that's being done is being done by us looking at the criteria, by us looking at observing the behavior, at us looking at the responses to the questions. We all know this hits everybody at some point in life, like I said earlier, but the key is knowing where you at. And when I say where are you at, I mean, are you experiencing a mild depression, a moderate depression, or a severe depression? And how do you manage that? And these are the criteria. Understand depressive symptoms last at least 2 weeks. If you got it going on for 2 weeks, we know what typically happens. What you stop doing? Sleeping? Don't want to go to work? Don't want to eat or overeat, perhaps. Taking care of hygiene is key. And so a lot of times, all these disorders, we look at some of the commonalities around how you're functioning. You know, what's your social life like? You're not doing nothing. You like playing pickleball at the gym. You're no longer playing pickleball. Or if you like reading and watching movies, you're no longer doing that. Or spending time with your significant other. Be aware of the signs of depression and how it impacts your life. And it impacts how you function. And when it impacts how you function, it's because it's also impacting how you think. Anybody have any questions about that? Mr. Cole?
Yeah.
Keep the mic, Mr. Cole.
Yeah. Okay. Yeah, my grandson is doing 50 years right now. And a thin line in the diagnosis between someone who appears to be stable and doing a substance abuse episode. Sometimes people have different reactions to chemicals that they take. He went mentally ill to kill my son's fiance after taking some drugs. So what do we name that thin line when you go crazy and there's no history that you can perceive? How do we, where's the middle ground for that type of mental illness that happens all of a sudden?
Excuse me. That's a good question. And I think part of, thank you for disclosing that too, by the way. I think what's important is the moment we see a sign is the moment we want to try to be able to provide some type of intervention and some type of assessment. Because a lot of times we see signs, but we don't know exactly what it is. Because again, you talked about he used substance use, he used drugs, but he also has some other stuff going on, underlying issues going on mentally. And so later part of this presentation, I will provide some resources that people can access in the event that you may want to try to help your loved one or significant other perhaps get a diagnosis of some kind. You want to say something, Professor Lee?
I was trying not to. One of the things I think we don't talk about enough is we live in Detroit, but how substance use, particularly marijuana use, has become so normalized. The grow industry in the state of Michigan is not being regulated as it should. A lot of the drugs that people are getting, particularly marijuana is still a Schedule 1 drug. Okay, and so that means that it still has illicit factors, it's still an illicit drug, that means it's not legally made, that means like the molecular structure of the drug is not consistent, and it is not FDA approved. So we have such a drug using culture in our world that when people smoke marijuana, especially if they get it from dispensaries, they think they're getting marijuana that is tested. It's just marijuana. A lot of it's being stepped on. That means that another drug is being mixed in it. Okay, so the molecular structure of fentanyl, street fentanyl, is 99.9%. Fentanyl is an opioid. It is one of the most abused opioids, and is being mixed with marijuana. And so when you say, how do people have a reaction like that, more than likely, if they were a common marijuana smoker, I'm not saying that that's the situation, they may have gotten some drugs that was stepped on that had some type of opioid or some other illicit drug, and it affects the brain functioning. And it affects the brain function, particularly if they have a mental health issue. They're already not baseline. They already have some up and down and some stimulant disorders. Dopamine, what's the 3? Come on, Jonathan. Come on.
Dopamine,
Come on.
air,
Serotonin. Or epinephrine. Come on. Okay, so those 3 feel-good neurotransmitters in the brain are always affected by stimulant drugs. And so everybody wants to feel good all the time. But if they have it mixed in with marijuana, more than likely they're going to have some type of episodic effect that's psychotic. And we don't have those conversations enough because we have normalized the use of marijuana. We do not have a public use ordinance in the state of Michigan. So it is not okay for you to come to class, walk around smelling like a house of weed. Okay? My students know me, so at this point I've been here 18 years. And so we have a medicinal law, and then we have what else? We have a medicinal law and a recreational law. Judge McConaughey now is not in here, he will love this. And so you can have enough, it's a certain amount you can have when you go from dispensary or from home. It's a personal possession for you to have on yourself, right? That's it. It doesn't mean you sell weed, it doesn't mean you get it from the dispensary and so we've made the recreational piece outside of the medicinal, we've made that so common that we think it's Amsterdam. And so now you got a lot of drugs out here, and we are comfortable with people being high all the time. We're comfortable with it. And we're not even gonna talk about the illicit drugs that we take for pain, opioids, that we take, you know, that are prescribed. A drug is a drug. This is what? A drug is mine or what? Well, I can't test to my students with this addiction class. Okay. They need to know. They can't represent me, need to know. Okay, so.
Thank you, Professor Williams. Give her a hand. No, that's perfect. And, you know, it's all, there's so much intertwined around substance use disorder, and you need to know how it impacts the brain and the whole neurotransmitter. That's a whole class in itself, because that's the pleasure side of the brain that says, I like this chocolate, or I like this chicken, or I like this pizza, or I like these high heels, or I like this sex. This thing is all the same pleasure that said this feels good, this smells good, this tastes good, and you're seeking to have that pleasure all the time. And that's when that addiction has now kicked all the way in. Yes, ma'am. Pass that microphone back.
Good evening. I was just recently watching this special about this mother who lost her son, and she thought it was fentanyl, but it was nitazine. And they said nitazine is 40 times more powerful than fentanyl, and they don't talk about it, so I was going to do a report on it.
I think it's good that you're going to do a report on it. I have been hearing a lot more about those type of cases. I don't think we've saw them necessarily in this area or this region as of now, but a lot of times those cases tend to happen in areas that drugs is not as the access like we have. We have access to everything here in Detroit. The Metro Detroit community, whatever you need. You need some cocaine, we can get you that.
He got it delivered through the mail. His friends had him send it through the mail. His mother was at home watching over him to get through the symptoms.
That makes
But
sense.
his
And which
two lady friends mailed it to him through the mail, and she thought he was in his room safe, and went in there and found out he had died.
What city were they in?
I didn't get the city. His name is Marquise Walton. I didn't get the city name.
Okay.
Just
That'll be
very
interesting.
touching,
I'd like to see your paper when you finish that. I think it's good. Actually, somebody just posed that same question to me earlier today. But, you know, I do want to kind of get back to just touching on a few more of these mental health conditions, because you all should have some knowledge and familiarity with some of this stuff in case you encounter experiences yourself or your clients. But there is something called generalized anxiety disorder, and as you can see, it involves excessive worry around areas of life, such as money, family, and work, which is common, right? But it's excessive worry. You know, so just, you know, familiar. Yes, sir.
Excuse me.